As you prepare for your total knee, if you're doing any research, you may come across advertising from the companies that make these implants. As a patient, it can be really hard to interpret this and can be somewhat confusing. So in case this is something you've come across, I thought it might be useful to know which particular one I use and why I've chosen to use it. There are lots of good options out there, but obviously I've had to choose one, and this is what I've chosen. It's the Zimmer Persona Total Knee. And I'm just going to walk through briefly why I use that one and what the features are that I like about it. Now, to begin with, we have to cover a little bit about what I'm trying to achieve during a total knee. I want the knee to be balanced between the medial or inside and lateral or outside portions of the knee. I want equal tension there so that as you move your knee, both when it's fully straight and when it's fully bent, it's balanced and it's not loose on one side relative to the other. And in order to achieve that balance, we have to go back to elementary school because the tool that I use is based on a seesaw. And I'm going to show you in a few subsequent videos here how this seesaw, which functions literally the same as the one that you played on the playground as a kid, allows me to achieve that balanced knee. So how exactly do I go about achieving a balanced knee with this seesaw? Again, my goals are to achieve a rectangle in extension and a rectangle in flexion so that there's equal tension on the medial and lateral sides in both of those positions. So I start by making these bony cuts here so that when the surgery is done, you'll have a nice straight knee. And then I take this screwdriver and I apply tension to the seesaw. And the seesaw has a gauge on it which tells me whether there's any asymmetry between the medial and lateral sides. And if there is, if this is reading more than 0, then that tells me that I have some imbalance. And I make adjustments to the soft tissues around the knee until I have balance. Or if we think of it like a seesaw, I make adjustments until the two kids on either side are the same size. Once that happens, this will tell me I'm at 0. It'll tell me that I have balance and extension, and I can move on from there to try to achieve a balanced flexion gap as well, so that throughout the full range of motion of your knee, you have good balance. Now we come to flexion. Because we've achieved a symmetric rectangle in extension, we want to do the same thing in flexion. And again, we'll use this seesaw here to achieve that. And here I'll show you how. We take the screwdriver again, and we apply some tension to the knee. What this does is it equally tenses the MCL and the LCL, the two ligaments on the side of the knee here. And with these in equal tension, the seesaw will give us the rotation of the eventual total knee that we need to have a balanced flexion gap, to have this be symmetric. So then I pin it in place, and I make the cuts corresponding to this symmetric tension so that I know before I've made those cuts that the eventual product of your total knee will have good balance in both extension and flexion, which is the goal I'm trying to achieve with my surgery. One of the other features that I like about the Zimmer Persona Total Knee is the various bearing options. These are the plastic inserts that go in between the femur and the tibia. The one that I use most often is called a medial congruent. And the reason I like this one is that it uses the shape of the plastic to drive the knee to bend appropriately in a manner that's very similar to the way that a native knee bends. In contrast, one of the other ways we can drive a knee to bend similarly to a native knee is called a cam and post mechanism. And you can see that here in the PS and CPS options in the video on my right. Now, the one drawback to this is that because of that post running into the cam mechanism on the femoral component, your knee clicks when it bends. Most people don't notice this and aren't bothered by it, and in many cases I still use those bearings. However, I like the option to eliminate that when I'm doing most straightforward total knees. One of the other bearings that you can see here is called the CPS. And I like having this option available to me because in cases where the knee has enough damage, particularly to the ligaments around the knee, that it's challenging to achieve the appropriate balance like I was showing earlier when I was using that seesaw, I can rely on this extra thick plastic post to provide some additional stability to the knee. Now, in the vast majority of cases, this isn't necessary, but if your knee is particularly hard to achieve appropriate balance for, the Zimmer Persona system makes it very easy for me to add in this plastic insert at the last step of the surgery to increase the quality of the balance of the knee. Now, all of these features about this particular total knee probably sound nice, but as a patient, you honestly may not care. You may just want to know that I'm going to give you something that works. And honestly, I don't blame you. And that's one of the other things that I like about this knee, is it has a very good track record of working. So if we go to the American Joint Replacement Registry, which tracks the outcomes of various total knees that are implanted in this country, they've tracked 67,000 of these knees out to 10 years. And at 10 years, only 1.5% of them have had to be revised. Similarly, the Australian Joint Replacement Registry is tracking about 17,000 of these knees out over time. And they're having very good results too. This gives me confidence that I can achieve a good result for you because this has a track record of success in thousands and thousands and thousands of knees that have already been put in using this system.